Quick service announcement is brought to you by Kiara, Anthony, and Sarah, and is about chronic myelogenous leukemia, also known as chronic myeloid leukemia. This leukemia is caused by irregular blood cells in bone marrow, and it's caused by sections of two chromosomes switching places and then making an abnormal one. Unhealthy white blood cells form and then proceed to crowd out the healthy white blood cells. The prognosis is normally good. It depends on what phase the person is in, their age, their overall health, their platelet counts, the size of their spleen, and the amount of bone damage that's already been done. 15% of all cases of leukemia are chronic myeloid leukemia. 1 person in 526 will get CML in their lifetime in the United States. 64 is the average age of diagnosis, and 75 is the median life expectancy.
There are 3 phases of CML: chronic, accelerated, and blastic. During the first phase, the cancer cells are growing slowly. Most people are diagnosed during the chronic phase. The number of non-working blood cells increases. People feel tired, get bruises, have night sweats, and feel pain in their bones. In the blastic phase, the abnormal cells have grown out of control. People are prone to infections, bleeding, skin changes, swollen glands, and bone pain.
Here's the normal leukocyte signaling pathway. Here, tyrosine kinase receptors are embedded in the cell membrane. Once signaling molecules or ligands attach to the receptors, they undergo dimerization and become activated. Then, a phosphate group separates from the ATPs and phosphorylates the receptors, transforming ATP to ADP. Relay proteins bond to the phosphates to activate and release the cellular response, which initiates the production of white blood cells. Here's the irregular leukocyte signaling pathway. Here, tyrosine kinase receptors are embedded in the cell membrane. Once signaling molecules or ligands attach to the receptors, they undergo dimerization and become activated. However, now tyrosine kinase inhibitors bind to the receptors instead of phosphate groups from ATP, which blocks the cellular response.